Loss of hearing is a natural consequence of getting older. Our hearing ability worsens in our 40s and onwards, and when we reach our 80s, more than half of us suffer from significant hearing loss. Age-related hearing loss is also called presbycusis. Another common reason of hearing loss is exposure to noise. It can also be a consequence of living in a noisy world. This noise can come from our work or from voluntary exposure to noise, such as noisy motors or loud music at rock concerts, nightclubs, discos, and from stereos, with or without the use of headphones. The increasing use of portable MP3 players is increasing the effects of hearing loss. Hearing loss can also occur as a result of other causes. It can be caused by some diseases and infections, certain syndromes, medication and drugs, damages to the ears, injuries to the head, malformation of the ear or blockage of the ear, genetic factors, tumors in the head, alcohol and tobacco, solvents, cholesterol. Types of hearing loss. A hearing loss can be sensorineural, conductive or mixed. A sensorineural hearing loss results from damage to the tiny hair cells in the inner ear. Age-related hearing loss, also known as presbycusis, is a type of sensorineural hearing loss, and so is a noise-induced hearing loss, which is a permanent hearing loss caused by prolonged exposure to high levels of noise. A conductive hearing loss is where the ear's ability to conduct sound from the outer ear through the middle ear into the inner ear is blocked or reduced. If there are problems with conducting sound to the inner ear and the hair cells in the inner ear are damaged at the same time, it is called a mixed hearing loss. It is a combination of a conductive hearing loss and a sensorineural hearing loss. A hearing loss can also be a bilateral hearing loss or a single-sided hearing loss. You can also have a hearing loss in one ear. It is called unilateral hearing loss or single-sided deafness. A hearing loss in both ears is called a bilateral hearing loss. A hearing loss can also occur suddenly from one day to the other. This is called a sudden hearing loss. In some cases, a hearing loss can be hidden. This is called a hidden hearing loss. It is a type of hearing loss that cannot be measured by a common hearing test. You may have a hidden hearing loss if you experience problems with hearing in situations with background noise. Symptoms of hearing loss. Most cases of hearing loss develop gradually, so the symptoms are often difficult to recognize. If you experience some signs of hearing impairment, you should contact your family doctor or hearing health care professional and have your hearing test. How to test your hearing. A hearing test comprises of a number of different examinations which, when taken together, can determine whether or not you suffer from hearing loss and to what extent. A hearing test is carried out by a hearing professional using professional equipment. But you can get an indication of how well you hear by taking our online hearing test. Definition of hearing loss. Hearing loss is divided into categories. The most common categories of hearing loss classifications are mild, moderate, severe and profound hearing loss. If you have a mild hearing loss, the quietest sounds that you can hear with your better ear are between 25 and 40 decibels. With a moderate hearing loss, the quietest sounds you can hear with your better ear are between 40 and 70 decibels. If you have a severe hearing loss, the quietest sound you can hear with your ear are between 70 and 95 decibels. And with a profound hearing loss, the quietest sounds you can hear are 95 decibels or higher. Prevalence of hearing loss. Hearing loss is fairly widespread. If you carried out a hearing test on a larger group of people, 1 in 6 would have a hearing loss of more than 25 decibels, which is the definition of hearing impairment recognized by the World Health Organization (WHO). This means that around 16 to 17% of all adults have a hearing loss. Numerous studies in Europe and USA have asked whether people have hearing loss. Around 10 to 11% of people asked answered that they believe they have a hearing loss. This is the same as between every 9th or 10th adult. The difference between the two numbers is because it is not everybody with a hearing loss who is actually aware of it. The older one becomes, the higher the likelihood that you have a hearing loss. Prevention of hearing loss. Daily exposure to noise is directly related to the risk of hearing damage. We are exposed to loud noises daily. For example, when we use headphones, when we are in traffic, the gym, the cinema, stadiums, cafes and at work. If the noise level is too high, it is a good idea to use earplugs. For an earache, wrap some garlic in some gauze and place it in the outer ear canal. Hearing can be improved up to 90%. You can use this method to help bring back hearing. Press the tip of the third, or ring finger, for about 5 minutes, several times a day. Press the finger on the left hand for the left ear, and right hand for the right ear. Pressure on the joints of this finger may also help. This is said to help improve up to 90% of hearing loss in cases of deafness due to thickening of the ear membrane, ear noises, and ringing in the ears, but everyone can obtain some benefit. Some foods and a low cholesterol and low carbohydrate count may ease your hearing problems. Dr. J.T. Spencer Jr. of Charleston, West Virginia says sudden deafness requires immediate medical attention, due to its many possible causes such as certain types of infection, a blood clot, poor circulation or other causes. Hardening of the arteries can lead to an insufficient supply of blood to the inner ear, causing sudden deafness. Dr. O. Eric Hallberg in the Journal of American Medical Association says on November 30, 1957, the continuing use of nicotinic acid, a B vitamin, in high dosages seems to be most beneficial both for its artery widening effect and for its apparent tendency to reduce the blood cholesterol level. Foods that contain the B vitamins include brewer's yeast, liver, wheat germ. A low-fat diet includes eggs, fresh fruits, fresh vegetables, gravy, lean meats, no butter, processed cheeses, starches. While deafness caused from an insufficient blood supply is fairly consistent, with ringing in the ears and dizziness, other types of deafness may come and go. It is not likely to affect both ears at the same time. Using lots of soybean lecithin every day can help to reduce or stop the ringing in the ears and clear hearing. Using garlic oil by puncturing a garlic oil capsule and pouring it into the ear and stopping it with a little cotton can help to relieve earaches. Some people have had good results in helping to clear up bad hearing and ringing in the ears by using a drop of onion juice in the ears about every week to 10 days to help maintain good results. Chewing gum that contains a natural sweetener called xylitol has been found to help prevent tooth decay and ear infection. Xylitol prevents bacteria from attaching itself to the back of your mouth, where it can later enter your ear and set off an infection. Note: too much noise can cause hearing loss, but vitamin A can protect your hearing. Consequences of hearing loss. Hearing loss can have a range of consequences. The implications differ from person to person, but most people with hearing impairment suffer some social, psychological and physical problems as a result of their hearing problems. Children can also experience hearing loss. Hearing problems in smaller children are normally caused by genetic factors, physical abnormalities in the ear, or it might be caused by certain diseases. In older children and especially teenagers, the hearing problems may often be a result of noise exposure. Treatment of hearing loss. Hearing loss can be treated, but hearing cannot be restored. In most cases, hearing loss is treated with the use of hearing aids. Some are treated with different types of implants, and surgery may cure some types of conductive hearing loss. A sensorineural hearing loss is normally treated with hearing aids. A conductive hearing loss can often be treated with an operation or removal of the blockage of the ear. In certain cases, hearing aids or implants might be needed. A sudden hearing loss must be treated instantly, and the treatment often involves the use of steroids. If you experience a sudden hearing loss, you should seek medical assistance as soon as possible.